Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Choledochal cyst and its classification. So there are 5 types. Let's look at each of them individually. So type 1, it is the most common choledochal cyst type. So we can write it as MC, that is the most common choledochal cyst type. It involves only the extrahepatic biliary tree. So it involves the extrahepatic biliary tree. Okay. The next point is it is generally in fusiform dilation. So it is fusiform dilation. Then comes this type 2. So what is the type 2? Type 2 is a saccular diverticulum. So it is nothing but the saccular. It is nothing but the saccular diverticulum. So saccular diverticulum of the common bile duct. So this is of common bile duct. So common bile duct is nothing but BD. So it is of the common bile duct and may be mistaken for an accessory gallbladder. So it is mistaken for the accessory gallbladder. Next we look at the type 3. So in terms of the type 3, it is a cystic dilation. So there is presence of a cystic dilation, and this is of the intramural common bile duct. This is of the intramural common bile duct, and this is present within the wall of the duodenum. So in the wall of the duodenum, and it is known as the choledochal. So choledochal. Then we look at the type 4. The type 4 is nothing but there is again the type A and the type B. The type A, it stands for the cyst, which involves the intrahepatic and the extrahepatic bile tree. The cyst, which involves there's the intrahepatic as well as the extrahepatic bile tree. So intrahepatic and the extrahepatic bile tree. So we're writing it as BT. Then 4B, it is again the multiple cyst limited to the extrahepatic bile tree. So it includes the multiple cyst and it involves the extrahepatic bile tree. So we're writing it as EBT. Now, lastly, we move on to the type 5. So what is special about type 5? It is also known as a Carelli's disease. So type 5 is also known as a Carelli's disease and it involves the intrahepatic ducts only. So it involves the intrahepatic ducts only. To learn and grow daily like this, please do subscribe.